Good morning. Thank you for joining the Hearsing School of Medicine's What's New with COVID-19 panel. Today's panel includes Dr. Megan Hayes, clinical psychologist and assistant professor in the Department of Physical Medicine and Rehabilitation. Dr. Laura Dreer was not able to join us today, but she will be joining us in a future wellness panel. We will start off with a few words from Dr. Hayes, and then we'll be taking submitted questions for the remainder of the panel. If you have any questions for Dr. Hayes, feel free to drop it in the Q&A chat below. For any media joining us today, we will be sending out a recording following the conclusion of the panel. To start us off, Dr. Hayes, can you tell us about the status of the COVID-19 stress and exhaustion relating to both children and adults?
Thank you, Brianna. And I will try to carry the weight of missing Dr. Dreer today. So yes, basically, I think I don't have to tell everyone out there that this has been a really long haul. So, we're now 18 months into this pandemic. I remember thinking myself, in 2020, those first, couple weeks when we were locking down that, we'll just kind of get back to normal pretty soon. And now looking back how naive I was, and I know I wasn't alone in that, that we thought it would be pretty short-lived and we'd be able to get back to normal life. So, along the way, we've had so many ups and downs. Most recently, we're coming off a pretty significant Delta surge in Alabama and in the whole Southeast. That has been very, very challenging for our community. Our ICUs were at capacity. It's also been extremely challenging for our healthcare workers. As a country, and the American Psychological Association has been following, kind of the reaction mental health wise to COVID since it started. And they actually put out an updated report this year in March, a year later, to see where we're at as a country. And their findings, I thought, were kind of what I anticipated. And also there were some interesting findings. The stress is getting to us. One of the things we saw was that weight management has been emerged as a significant concern. So the majority of us actually gaining more weight than we would like, but some people have also lost more weight than they would like due to reduced appetite from the stress. We've also seen sleep disruption, increases in insomnia, and I can go into that more if you guys would like. And so that's, of course, when you're not sleeping well and you're not getting sufficient sleep, that can also put us at risk for things like anxiety, depression, and exacerbation of mental health concerns. We've also seen that certain groups are more vulnerable than others. So the impact of this huge stressor over the last 18 months hasn't necessarily been distributed equally. And one of those vulnerable groups have been parents. So anyone who is a parent could probably speak to the burnout is real. And it's been a really long haul with the ups and downs of, will school be closed? Will we be doing another virtual year here? What does this mean for my child and their development? So that group's been very vulnerable, as well as our essential workers. So I just kind of wanted to highlight some of those findings from that study. But overall, the impact has not been so great on stress in America and in our region in Alabama.
Thank you. Could you also discuss some additional wellness details, including ways to maintain mental health, especially as we continue on during the pandemic?
Absolutely. And, in the Q&A, I'm happy to answer more specific questions. When asked about how to maintain mental health and well-being during this time, I kind of think starting with the macro level factors. So these are the wellness behaviors that can help to prevent exacerbations in mental health problems and can help to manage mental health problems when they do exist. And some of those that are supported by research, I always point out exercise. You guys have probably heard that a lot. And I know that's thrown out there quite a bit, and it's easier said than done. But exercise really does have well-documented evidence base for improving mental well-being and, of course, physical well-being. Both are important and they're bidirectional, so they're interrelated. So I can't stress enough the importance of some type of movement, at least, a few times a week. And I believe the recommendation from, kind of the CDC is 150 minutes per week. So that's something to strive for. But I always tell people that something's better than nothing, and don't get caught up in the all or nothing thinking. You've got to start somewhere. So even if you start with a 5-minute walk each day, that's something, and you can gradually increase your time. So that's certainly one macro level factor. Another that's often forgotten is sunlight. So as we were all going through lockdown mode, I know many people did go outside more often and they did explore the great outdoors. And I think that was actually a great positive side effect of the pandemic, that people got into nature more and maybe got to reconnect with that. But there were still other groups that may have actually shut themselves in more literally than they needed to. And that kind of did not facilitate the best mental health. So sunlight daily, I tell people to aim for about 15 to 30 minutes. Generally, the more, the better during the day. But of course, that's important for vitamin D. But not only that, it regulates serotonin, which is an important neurotransmitter for overall mental health, as well as melatonin. It helps you sleep better at night if you've actually had exposure to bright light during the day. So along with that, I would also say at the macro level, social support. So really relying on your social network. It doesn't matter if you don't have a ton of friends or family and a huge community around you. That is okay. In fact, just having one or two people who you really trust and feel like you could tell anything to can make even more of a difference. So the quality of your social support matters a lot. But that also requires that you actually reach out and talk to them and share with one another and be honest about how you're feeling. So those are just a few of my favorite, macro level wellness areas to tell people about. But at the micro level, I also think about like internal coping that people can do when they are feeling down, stressed, depressed, anxious. And there are a lot of evidence-based techniques there. Some of the quickest ones that I really like, one is the practice of mindfulness. Mindfulness does not have to be an extensive 30-minute exercise. In fact, that sounds pretty brutal to me, especially if you've never had much exposure to mindfulness meditation. You want to start small. Mindfulness is simply a concept. It means being in the here and now, being aware of your thoughts, feelings, and your surroundings in the current situation without judgment. So you can practice this anytime, anywhere. You don't have to have a special app, although those do exist. But you can practice this simply by going on a walk and activating your five senses and saying, okay, what are 5 things I can see right now, and name them to yourself: the trees, the leaves, the colors, right? What are some things I can feel? The temperature of the air, the wind, right? The sounds I hear, the birds chirping. So you can walk yourself through a mindfulness exercise that way, or also just get in touch with how you're feeling. So I'm noticing that I'm feeling kind of bad right now. I'm feeling kind of anxious. I'm feeling uncertain. And that can actually go a long way too. And just being with that feeling instead of trying to escape it with something like food or, substances, for example. So just riding that wave of emotion can be really important, and just practicing feeling bad sometimes, although it might sound a little strange. And some other techniques I really like for internal coping, I think relaxation techniques are very great. So breathing and breathing retraining is what we call it in my field, is very helpful. And really the best way to do that is to focus on your exhale. So anytime we inhale and we are feeling kind of anxious, we may breathe a little too shallow. And when we do that, it can actually activate what's called our sympathetic nervous system. And that's our fight or flight reaction. And it can make us feel even more anxious. So the old advice of take a deep breath may not be as helpful as we think. So really focus more on taking a long exhale. And I tell people to do this through pursed lips, like you're breathing through a straw. And by doing that, we actually activate our parasympathetic nervous system, which is our rest and digest system. And that can help to calm us down. So those are just a couple of my favorite techniques, Brianna.
Those are both great. I think I can personally use those in my own life.
And I do too.
Could you say a few words about how to talk to patients or parents who may be vaccine hesitant or maybe misinformed?
Yes, that is such a great question. And let me point out, of course, I work in the Office of Wellness within the School of Medicine here at UAB. And I can say that this is a major source of frustration and kind of increases the burnout that our physicians are feeling. It does lead to those kind of feelings of anger for our healthcare professionals. It is really challenging for them, and myself included in that, to know that vaccines could really help, could really keep our patients safe, and to be up against such great, force in terms of strong opinions on not trusting the vaccine or medical advice. So I do want to point that out and really just validate how hard that is for a healthcare professional. So whether you're just someone who wants to convince a family member to get the vaccine, or you're a healthcare professional trying to convince one of your patients, the number one piece of advice that I can give you is to stay curious, right? So when you go into the conversation, you are not going into the conversation with the goal of persuading the other person. I know that is really hard to do, and maybe it's hard to pretend that that's not your goal, because I know ultimately that's what we all would want if you're trying to have that conversation. But really, it's best to go in with, I'm going to hear what this other person's perspective is. So if you're a physician, for example, working with a patient, you're in clinic, you want to talk to them about the vaccine, you would first want to just ask permission, right? Ask permission is, I'd really love to talk to you about getting your COVID-19 vaccine today. Would that be all right? And the reason why that's important is because it can help give the patient a sense of control and that they're feeling listened to and heard. So you want to, first of all, give them that option. If they say no, you have a couple of options there. One option is to say, well, I completely respect that. I understand that you don't want to talk about the vaccine today. I hope that we can talk about that in a future appointment, because I care about your health and the health of your family. So please come to me, we'll talk about it next time. I'll keep asking. And that's completely reasonable, but you're respecting that person's boundary in that case. And that can actually plant a seed and help build trust for the next visit. Another option that you have is just to spend time with the patient, trying to understand why they're hesitant about the vaccine in a very curious and non-judgmental way. So, okay, I completely understand that. I'm hearing that a lot these days. Tell me what concerns you most about getting the vaccine. And so I would also say that overall, you want to take an approach when you're talking to an individual who's vaccine hesitant, whether you're, again, a healthcare provider or just a person trying to talk to a friend or family member, of what's called motivational interviewing. This is something that we are trained in as psychologists. And certainly I don't expect everyone to be an expert in this, but the principle is just to be open, empathetic, let the other person lead the conversation, and to roll with resistance. So when someone says no, you don't say, "Are you kidding me?" right? Or in so many words, you say, "Gosh, I respect that. Tell me why it's so concerning for you," right? And coming from that place of curiosity and empathy can be really important. So the CDC, I will say, for healthcare professionals, the CDC has a really great handout for healthcare workers on talking to patients about the vaccine that has kind of a primer in this strategy of motivational interviewing. And I'd highly recommend that you review that if you are in the healthcare setting, because it can give you a bit of guidance. But I really do want to just validate how tough these conversations are. But I can guarantee you that arguing isn't going to get you anywhere, and can in fact have the opposite effect, where the other person that you're trying to convince actually digs their heels in further and can actually make them kind of take that stand against vaccination even more.
That's great advice. Thank you. We got a question in the chat. How can you manage pandemic burnout at work? Some may be struggling to disconnect from work and they feel caught in this cycle of burnout, such as like feeling exhausted when they're at work or feeling guilty when they're not at work and they're trying to rest. Do you have any recommendations or advice for that?
Yes, and that is certainly something that we are seeing. And one thing that we've learned from our UAB pulse survey from the Office of Wellness is that really everyone's experiencing this. Sure, there are some groups that may be a bit more distressed than others, but all of us, physicians, residents, staff, everyone's more distressed than they were before. So this is happening. And in terms of the workplace burnout, there are systemic factors that contribute to burnout. And I can assure you that the UAB Office of Wellness is monitoring these and working on them. And that's why we have distributed the Pulse survey to gather more information to see where we could best intervene and help reduce burnout at the systemic level. But at the systemic level, these things take time, right? We know things move kind of slowly when we're trying to change a system. But I can guarantee you that those factors are being paid attention to. Things like the electronic medical record, appropriate PPE, having enough staff, right? So having, staff shortages can play into that burnout, of course, and we've seen that with COVID. But then at the individual level, that's where we really have the most control and things that we can do right away. So even as we're waiting for systemic change, I always tell people to focus in on the here and now and what can you do, what is in your control. And certainly at the workplace, something that is in your control, even if it doesn't feel like it sometimes, is setting up appropriate professional and personal boundaries. So realizing that if you don't protect those boundaries for yourself, maybe no one else will, right? And so that is really our responsibility to make sure that we take our vacation time that is given to us, that we are allowed to take our sick leave when we are ill and we need it, and to go ahead and do that, right? To take that time and that boundary, put that away message up on your email and to say, I am truly out of the office, right? To the extent that you are able to do that. And, you can forward pagers, you can forward Vocera, right? And you can forward those impact messages, for example, and making sure that you are taking that time for yourself. And you really do need to protect that. Not only that, it's not just a vacation, but every day protecting some time for yourself. So a lot of people tell me, I'm just going to wait until my vacation and then I'm going to have this whole week or two off. And after that, everything will be better. But their plan is to kind of be miserable until then. And that's really not a great strategy. Find ways to implement wellness and boundaries into your everyday life so that every day doesn't feel like such a drag, so that you're not going in feeling terrible because you are refreshed. So that may mean, for example, no matter what's going on, you always cut off work at a certain time at night. So your to-do list will be there, right? It's going to continue. You cut off, right? I'm clocking out. So I'm done with notes. No matter what, I'm taking this time for my evening ritual. Or if you're working at night, my daytime ritual, right? So I'm going to have this wind down time. I'm going to prioritize my sleep because we know that insufficient sleep can really impact burnout further. Not only that, but we also know that sufficient social support from coworkers and supervisors is really protective against burnout. So being able to kind of support your colleagues, if you are a supervisor, checking in with your employees and seeing how they're doing, because that really is one of the most important factors. Beyond that, I would also say for burnout, rooting yourself back into your sense of meaning. So if you see this pandemic as more of a kind of call to action and finding meaning in that and helping people through this pandemic and patients who are very, very sick, you may actually find more purpose in your work and you will be more reoriented to your why. And that can actually help to manage burnout. It's when we start to lose sight of our purpose and why we're doing something that burnout can really get severe and even lead to things like moral distress and depression. So really rooting yourself in why you're doing this in the first place and what your purpose is at your work. Just a few strategies.
Those are great. Another question from the chat. What would you recommend for children who are having trouble understanding why we need to mask in schools and are stressed by the lack of the consistency that may be in schools?
Yeah, that is a really good question. And this is, although I'm not a child psychologist, I do work with many parents in my roles. So, and I have had to help many parents guide, how do I talk to my toddler about this or my young child? And it is very complicated. I mentioned some vulnerable groups earlier, from the Stress in America study. And one thing we found is that young people are a member of one of those vulnerable groups, that this has been particularly challenging for them. So, masking is just one aspect of that. But even that, right? Imagine that's pretty strange. You're a child and having to wear a mask every day. There's certain ages where resistance is very common anyway, such as toddlerhood, right? So recognizing that that's normal, that you're not doing anything wrong, I think can be really helpful. How do we get kids to do it? There's a few strategies that I like to tell parents about. One is, first of all, modeling. So keep in mind that kids really like to do what we do. If they see you and their maybe older siblings and other people around them wearing masks, they're going to start to mimic that behavior. That's why kids love carrying around, fake cell phones or your phone, right? And pretending like they're doing things that adults do. So they do start to learn based on modeling. And so you can set that example by always wearing your mask in situations you want your child to wear the mask. You can also, children learn through play. So you can practice at home play, right? For example, you could play that you're a doctor and you're putting the mask on and they're at an appointment, and you could have them practice putting the mask on and off. You guys could take turns putting masks on some of their stuffed animals or toys, right? And kind of playing with that and making it normal. You can also have them practice. So the key is preparation, right? So you don't want to just not ever have them wear a mask and suddenly they have to go into their doctor appointment and, oh, we need to put a mask on. They want to be used to this, and you want to have prepared them. So you'll tell them ideally the day before that, hey, we're going into your appointment tomorrow to see Dr. So-and-so, and we're going to be wearing the mask. So let's get some practice in. Let's practice with your doll here, right? Kind of making it fun and positive. And then you can also have them practice wearing the mask for short intervals at home. And let's say they get to 30 minutes, they get a sticker or some kind of fun treat or toy, that they get a reward. So behavioral reinforcement works very well. And then as they extend the time, they get another sticker, right? Or another reward. So that's fun for kids. They realize that when they keep it on, something good happens. Also, explanations that are very concrete and developmentally appropriate is important. So, if you tell your kid, we're wearing these because we want to protect ourselves from germs and we want to protect others from our germs, this is helping others. They may even start to feel a sense of pride and proud to wear their mask. And finally, you can also show them pictures of, even like, kids in the community, kids on Instagram or something, or even celebrity kids wearing masks to say, look, everyone has to do it. Everyone wears them. And actually I said finally, but there's one more important thing. For kids, a sense of control can go a long way. So if they get to pick out the mask, and even if they, for instance, their favorite, character or superhero or something, or the colors that they like, that can go a really long way because they like the mask. And same with they may not like the mask with the loopholes, the ear holes, but they may like one that ties and they're willing to wear that. So kind of working with your child or children on what's going to work for them.
That's great. Thank you. So previously we mentioned stepping away from, the desk or from job and turning off the phone, forwarding the pages. But a question in the chat that we have is, what are some specific steps to make it important to do these things without feeling bad for stepping away?
Yeah. So realize, first of all, that in academic medicine, of course, I think, and in medicine in general, there is that culture of, we're the helpers. We work hard. We do everything that we can to help our patients. And I think the reason it's such an internal struggle for us in healthcare is that we do want to feel like we've done everything that we can, and it's embedded into the culture. But the problem with that is that if we don't take time to care for ourselves, our work, our productivity actually suffers. And there is a U-shaped curve in terms of productivity, that the more time we spend on tasks doesn't necessarily equate to more productivity. And in fact, with burnout in healthcare, we know that the more burnout we become, the more hours we're spending at work, the more medical errors can come up. So I think one step is to tell yourself when those thoughts come up of, oh, if I, miss out on work today, other people are going to have to shoulder this burden, or people will judge me for taking this time off. I think you actually need to take a step back and think, what could be some potential consequences of not taking time off or of not setting up those boundaries? So gosh, like maybe I'll be more at risk for medical errors, or maybe I'll ultimately be a disservice to my patients because I cannot listen to them well enough. I'm too stressed out, and my emotional bandwidth is so stretched thin that I really don't even know what I'm doing, right? That, moment to moment, I can't concentrate, and I'm starting to make mistakes, and I'm not as effective. So thinking about that, and not only the consequences at work, but what are the consequences at home? So if you have other people in the household, you have a partner, you have kids, is there anything left for them, right? And is by not taking this time with them and this time off hurting my primary relationships that probably mean more to you at the end of the day than your job? So really rooting yourself in your values. What am I doing all this for? And what could potentially suffer if I don't take the time off? And one thing that I like to talk to my healthcare professionals about that I see as clients is kind of having a little box or something symbolic at the workplace, whether you've got an office or you're at a nursing station, wherever you kind of spend most of your time. And that's the box where at the end of the day, whether you actually do write things down or just symbolically drop everything at that box, we're done, right? We're compartmentalizing. I am leaving work now. And I think that can also help to have that symbolic moment of separation and compartmentalization. And that's why I also recommend that, honestly, if you are working at the workplace, and because I know some of us are working from home, but as healthcare professionals, many of us are in the hospital. So if you're at the clinic or in the hospital, keep work there. Really try to keep your home a place where you don't work. Try to finish up your notes before you go home, if at all possible, to keep those two places separate. And that way, when you're at home, you're not thinking, well, I could be doing work, because your brain's already primed for when I'm at home, it's family time or dog time or just me time, right?
That's great. We have just a little bit more time, a few more minutes. So we had a question in the chat. What would you recommend if we notice someone else, like a colleague or maybe a friend, is having a hard time with mental health or wellness? How do you have that conversation? What are some key subjects that you would address?
Right. And I'm really glad that, that question is in the chat, because this is an important step in starting to reduce stigma for mental health issues, is to just open up the conversation. So simply by opening up the conversation at all, you've taken an important step potentially in helping another person, reducing stigma on mental health, and just overall, potentially making a difference. So let me commend anyone who takes the step, and don't let that anxiety prevent you from saying something, right? So just if you see something, as I say, if you see something, say something. But that being said, there is an appropriate way to go about this. And you certainly don't want to walk up to the person and say, you look bad, right? You look tired, you look worn down. Maybe that's not the best way to go about it, although maybe that's what we're thinking. But certainly just checking in, right? Especially if you're already cultivating great conversations with your coworkers anyway, hopefully you could just put it in kind of casually, even mentioning your own struggles, since so many of us are having struggles during this pandemic anyway, can be a nice way to open it up. Gosh, this is really wearing on me. It just seems like with this surge, we're just seeing so much death. It's been really hard. How are you doing? And so you can always lead with your own experience, and that kind of disclosure breeds trust, right? So you're disclosing, maybe they're going to disclose a little bit because you've opened it up and made them feel comfortable. You could also just ask something along the lines of, how are you doing, right? Without even having to disclose yourself. You don't want to, or you are feeling okay. You could say, hey, just checking in, how are you doing? I know it's been a rough year. I'm trying to check in with people more often. So you could certainly do that. And, I would also say to be familiar, maybe like if you plan to talk to one of your colleagues, to be familiar with some of the resources that might be available to them. So for example, at UAB, we have the UAB Medicine Office of Wellness. We have the UAB Employee Assistance Counseling Center. So maybe kind of having those resources in your mind of like, well, if they do open up to me, where can I send them, right? Because your role is to be a colleague and a friend and not to be the mental health professional. So you don't have to feel that pressure of let me conduct a therapy session, because that's not what you're there for. But you can also have some referrals. But I can assure you that just listening to the other person and asking how they're doing, even if they're not ready to talk about it that day, can go a long way.
That's great. Thank you so much. And that's all the time that we have today. So thank you so much for joining us. The next panel will be Thursday, October the 28th, and that will be with Dr. Fran Lund and Dr. Kevin Herod. All right. Thank you, Dr. Hayes, for your time, and we hope everybody has a wonderful day.
Thank you, everyone.